Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now for carcinoma esophagus is done. Okay. Now the next tumor is leiomyoma. Leiomyoma is actually the most common benign tumor of the esophageal tumor. Most common benign esophageal tumor is leiomyoma. It is most commonly seen in 4th to 5th decades of life, and it is more commonly associated with males when compared to the females. Then it is a smooth muscle tumor. In 90% of the cases, it is located in the lower two-thirds of the esophagus mainly. It is located mainly in the lower two-thirds of the esophagus. In the lower two-thirds of the esophagus, and most of the cases, it is usually solitary tumor. It is actually a solitary tumor usually, and it is oval in shape in most of the cases. Okay, this leiomyoma is intramural. It is an intramural tumor with the mass protruding towards the outer wall. It is an intramural tumor with the mass protruding towards the outer wall. Then if you see, the overlying mucosa is freely movable and has a normal appearance in leiomyoma. The mucosa is freely movable and it has a normal appearance in leiomyoma. Then, if you see the clinical features of leiomyoma, most leiomyomas are actually asymptomatic presentation, and in some cases the patient might present with dysphagia and pain are the most common symptoms for leiomyoma. Location and size does not correlate with the symptoms. Location and size of the leiomyoma does not correlate with the symptoms. And what is the investigation of choice? Barium swallow is the investigation of choice of leiomyoma, where we see presence of classical smooth punched out lesions are seen. Punched out defect is seen here. Like for example, if this is the esophagus and this is the leiomyoma which is present. Now when you do a barium swallow, okay, in the barium swallow actually you will see that a punched out lesion which is something like this. You will see a defect. Punched out defect is seen because the barium will only fill this area, not the tumor area. So as a result, it looks like a punched out lesion defect is seen on a barium swallow, and thus this is the investigation of choice. Then endoscopy can be done. On endoscopy, you will see that it is a freely movable mass and which bulges into the lumen. One more important thing is it should not be biopsied because there is an increased risk of perforation. Because there is an increased risk of mucosal perforation at the time of surgical enucleation. So when we do biopsy, biopsy is not indicated in case of leiomyoma. Then what is the treatment? Enucleation is the treatment of choice for leiomyoma.
thank you and thank you for watching.